Hello, everybody. This is Gary. Today is Friday, July 17th, 2020. It is 4:52 p.m. Eastern Standard Time in Rochester, New York. And this is just a quick update on my schizophrenia. Um, Day before yesterday, I went to the psychiatric emergency room because I was hallucinating, feeling very nervous, agitated. I wasn't suicidal or violent, but I wanted to go to the hospital to talk to somebody. So I called an ambulance. Of course, they sent the police first. In New York State, that's the procedure if there's a mental health call. Even if you're the one calling yourself, they send the police to make sure you're not carrying any weapons or anything sharp or dangerous. Um, Sometimes they'll check my pockets before I get into the ambulance. Um, there is such a thing in New York State called a mental hygiene arrest. They didn't do that with me this time because I went in voluntarily and I called the ambulance myself. Um, for some reason, they actually did not check my pockets before I got into the ambulance. The police asked me my name, my date of birth, my social security number, that kind of thing. But anyways, in New York City, a mental hygiene arrest is when they can take somebody by force, if necessary, to a psychiatric emergency room for an evaluation by a psychiatrist to see if the person is potentially violent, homicidal, or suicidal. A mental hygiene arrest does not mean a criminal arrest. There's no criminal charges involved in that. It's simply a tool that New York State and the police can use to get somebody who needs to be evaluated by a psychiatrist into a psychiatric emergency room to be evaluated by force if necessary. Um, but, anyways, I went to the psychiatric emergency room feeling agitated. I was hearing voices. They were telling me people were following me, trying to hurt me. So I had strong paranoia to go along with that, thinking people are following me. Sometimes I still think things like that. I was just at the store a few moments ago before I came home, and I thought somebody was following me into the store and looking at me, but I have no actual evidence of that. It was more of a feeling than a thought. Um, so my psychosis is always there to some degree. Um, my hallucinations are always there to some degree. I don't see things that aren't there, but I do hear things that aren't there, voices in particular. Um, but I went to the psychiatric emergency room. I was there for about maybe 4 hours until they finally got around to evaluate me. I talked to first one of the psychiatric nurses just to get some general information about why I was there and some other medical information, including had I ever been tested for COVID-19, coronavirus, and other medical questions, questions about my medications, questions about why I came into the hospital, that kind of thing. A couple hours later, I was able to talk to a psychiatrist. I told him I think I just panicked when I called the ambulance and the police. I was feeling agitated and I was hearing voices and I was paranoid. Um, I felt really uncomfortable. Had been for actually a few days. Wasn't sleeping well for 3 or 4 days before I went to the psychiatric emergency room. Um, I've cut back on my caffeine because I think caffeine fuels a lot of my paranoia, hallucinations, and anxiety and fear and insomnia. So I'm cutting back on coffee to 1 or 2 cups in the morning. If I drink coffee in the afternoon, I'll be up all night. And hopefully I'll get some sleep tonight. I got some sleep last night. That partly depends on my neighbors. They're young kids and they like to throw parties that are kind of loud. Although they actually haven't done that in a while. But So I went to the psychiatric emergency room. They evaluated me and they sent me home because I wasn't suicidal or homicidal. I was still very agitated when I got home. I eventually did fall asleep. I got home around midnight. I think I fell asleep around 2 a.m. This is day before yesterday. Got some sleep. Was having panic attacks this morning, and I realized it's probably because I drink caffeine. And caffeine's, in my case, is like a dangerous drug. It just aggravates all my psychiatric symptoms, like paranoia, hallucinations, delusions, depression, anxiety, worry, fear, that kind of thing. So they sent me home. I came home and I went to sleep around 2 o'clock, got up around 6 a.m., got about 4 or 5 hours of sleep. Um, got about 4 or 5 hours of sleep last night. Um, Insomnia can be really bad if you're having psychotic symptoms. If you go 2 or 3 days without sleeping or 4 days without sleeping, that can really aggravate hallucinations. And even if you're not mentally ill, if you have insomnia for a long period of time, you could actually start hallucinating and having paranoia and other psychotic symptoms, even if you've never had them before. So if you already have schizophrenia and hear voices and have delusions, then the insomnia just makes that 10 times worse. Um, but I'm doing fine today, trying to keep to a daily schedule, trying to keep busy, trying to get out when I can. The weather's not too bad today. Yesterday in Rochester, we had a really nasty thunderstorm, but today's pretty mild out. It's about 75 degrees outside. I rode my bike outside, then I went to the store to buy some food. Um, so my paranoia is still there to some degree. Like I mentioned, when I was at the store, I thought somebody was deliberately following me. Um, Hallucinations are there to some degree. Certainly, anxiety and fear is still there to some degree. Um, I just have a lot on my plate that I'm trying to do. I'm looking for a new apartment, and I don't know yet if I'm going to get accepted to the places that I applied, the apartment complexes that I applied. I would like a bigger apartment. I'm living in a studio and I'm paying $625 a month for rent. If I'm going to pay that kind of money for rent, I'd like a bigger apartment. But I'm not sure how soon I can arrange that. Depends on a lot of different factors, including past landlord references, which I think are actually pretty good. I have a good relationship with the landlord I have now. I contacted one of my old landlords by Facebook this morning. Got his phone number so I could use him as a reference for new apartments. Um, I think I'm spending way too much time alone. That aggravates my symptoms, my anxiety, my fear, my depression. Um, so I'm going to try to make an effort to be around other people as much as possible. But other than that, I'm doing okay. And comment, like, share, subscribe. Press the notification bell if you want to know when I put out new videos. Share my videos on social media if you want to help my channel. And click the notification bell. And if you have any ideas for a video you want me to do, let me know in the comments section.